Hi guys, good morning. Welcome to another session of AMA with Dr. Behnam. I'm Dr. Behnam. I'm the board certified dermatologist, founder of Happy Head, and the chief medical officer. So welcome everyone. Thank you so much for all the great questions you guys usually ask. I love them, and it's really it's great for me to come online actually and chat with you guys, and I think a lot of patients appreciate it as well. So we're going to start with first question. I recently was placed on Lexapro to help me deal with PTSD, loss of family member. Recently, I've been losing hair off from the crown, front crown, rapidly. Can this be from the medication? Well, that's a very good question. It could be from multiple different things. One, it could be from the stress of the PTSD. That by itself, basically, it could cause, anxiety and hair loss. The Lexapro medication is possible, but not really. I'm more of a Zoloft fan, so when patients are really anxious, I put them on Zoloft, and it really does help the patients. Again, I'm don't really think that the Lexapro could cause. I think a lot has to do with the anxiety and the PTSD of the loss of a family member. So sorry about that. But thank you for asking that question. We're also going to now talk a little generally about our topical finasteride. So the finasteride, basically our topical formula, remember, is a customizable formula, which means that we customize this product just for you. Our standard formula is the finasteride 0.25 along with a minoxidil 8% and retinoic acid. It also has some hydrocortisone in it. But remember, if you start using the product and have any issues, basically, please let us know and we will adjust that formula just for you and basically we'll ship you a new one. Now, how does hair loss affect men and women differently? That's a great question. So hair loss, basically the clinical position of hair loss is different in women versus men. So typically when guys lose their hair, basically they're going to start to thin out at the widow's peak and basically starts to go back. And also they're going to start to lose basically in the crown area. In females, when females start to lose their hair, is basically they start to lose in the frontal scalp, not in the frontal hairline, and typically not in the widow's peak. It's more basically in the frontal, basically scalp area. That's where they lose their hair. So that's a classic area for females. And also, the treatment is different. So typically for guys, we treat with finasteride. So our topical formula has finasteride 0.25% along with minoxidil. Whereas for females, if you're below the age 50, we usually include spironolactone along with minoxidil, and if you're above age 50, we have it with finasteride along with minoxidil. So males and females, depending upon the hair loss, have different treatment options, and also it depends on the age and past medical history and allergies. So this is why it's so important to get a consultation, basically with a doctor. We have board certified dermatologists, basically who will do your consultation for you and come up with the right customized script formula. And basically, then that's the one that we're going to fill from our pharmacy. Um, is female pattern baldness possible? Yes, it is. I mean, but it's very unlikely. Usually, when females lose their hair, basically just thin out. You very rarely see basically female patients that go bald, but basically they just thin out. Now, another common thing that happens in females is that basically sometimes when they put the hair in the tight ponytail, you start to lose basically the edges, what's called traction alopecia. And with traction alopecia, definitely the topical works really well along with a derma roll. So if you derma roll and use the topical, basically is very effective. Also, injections like PRP also help quite a bit as well. What is the maximum minoxidil recommended for women? So typically we do 6% minoxidil for females, and the reason is because sometimes when you go on a higher concentration, you will get some peach fuzz on the face. Now we do have some female patients that do use the 8%. It really depends on the individual. And again, that's customizable. So if you ever want a higher concentration, just let us know and we'll be more than happy to do that. And also, please remember, we also have oral minoxidil that females could go on as well, and they also see pretty good results. We do have that available as well if anyone is interested. Would happy work for female patients over 60 and older. Yes, we have a lot of female patients that are over 55 and 60 and do use Happy Head, and they do see very great results with it. So yeah, so the Happy Head is not just for younger male or females, it's also basically used by older patients as well, and they get very good results. The only caveat to that is that we have some guy patients, male patients, basically that are complete bald, and basically they send the photos. In that case, look, if you're bald, the Happy Head will not help you. Happy Head mainly helps you when you are thinning, not necessarily when you're bald, because you need some of that those hairs basically to thicken up. And if there's ever any questions, please feel free to contact us at help at Happy Head, and that will help basically quite a bit as well. It would basically, you can send in the photos, we'll evaluate, and we'll let you know if you're a candidate or not. So that's a very easy way of basically getting evaluation. Help at happyhead.com, and they'll forward to me, and I will basically evaluate it for you. How does spironolactone work differently from minoxidil? Great question. So minoxidil is a blood pressure medication, and the way it works is that basically it takes your blood vessels and basically enlarge. It's called vasodilation, makes the blood vessels bigger. As a result, more blood gets to your scalp, and more blood flow to the scalp basically washes out the other DHT, but it also brings more oxygen to the hair follicles, which in return reduces your DHT level in the scalp. Spironolactone is what we call is a testosterone receptor inhibitor, which means that so your testosterone binds to certain receptors on your hair follicles, and spironolactone is blocking that. So that's how it works. And the way the finasteride works is that it inhibits your testosterone from converting to DHT. So basically, and DHT is the one that binds to your receptors. So it's inhibiting that conversion. So they all work in different aspects and different pathways of hair loss. And this is why we usually combine multiple different ingredients together, the minoxidil with finasteride or minoxidil with spironolactone, because together basically you're hitting them at different points along the hair loss pathway, and you're going to see better results. If you lift weight at the gym, hence increase testosterone, does this might have a worse result on your hair? The answer is yes, it could, but look, if you're gonna lift weights, then you're gonna lift weights. I mean, it is what it is. But there are also things that we could do to kind of prevent worsening of that hair loss. So, for example, so going to the gym is fine, but a lot of patients also supplement with whey protein isolates, and isolate basically has increased concentration of certain amino acids like valine, isoleucine, and leucine, and as a result of those specific amino acids basically will increase your testosterone level. So we usually recommend that although you're going to go to a gym, which is great, and that might by itself increase the testosterone level, at least do not supplement with products that might increase it further. So don't do any whey protein isolates, and don't do energy drinks because those are bad. And also stay away from soy, anabolic steroids, DHEAs. And if you don't need exogenous testosterone therapy, don't do it. So, for example, some patients have low testosterone and they need to use the testosterone gel or patch, or basically take it internally. Well, if you don't need it, don't do it. If you need it, then that's a different story. But again, thanks so much for that question. Another patient asks, "Hello, doctor. Side effect aside, if oral finasteride isn't giving side effects, would topical finasteride still be your approach?" Great question. So the reason why we made Happy Aid was twofold. One was that clinical studies showed that oral finasteride could have more side effects than topical, so that's why we chose topical. But number two, see, when you take something orally, it has to go through your entire body before it gets to your scalp. So the question is, how much is it really getting to your scalp? When you apply something topically, you're putting it exactly where your body needs it. So you're putting it directly more at the source. So I always felt that topical is just a better way of doing it, just because you're putting it where it counts, and you're putting it exactly where you need it, and is basically before it hits the right target. So from those two perspectives, that's why we made Happy, and that's why we think Happy works the best. Now, that being said, In my office, when patients come in, we usually do start them happy at first. Reason being is because you reason being is because your risk of those initial side effects is less, and as a result, your body acclimates to it better. So a lot of patients would even if they want to go on oral, I rather use them topical first, and the body gets used to it, and then we switch them over to oral, and they usually tend to have less side effects. And also, honestly, also noticed that patients that use oral and topical finasteride end up with better results than using either one alone by themselves. So basically, to answer your question, the answer is yes. I would still go with the topical first and see how you do before we say you start doing the oral. But if you're only on the oral and you're not having any side effects and you're having great results, then just stick with the oral. The only time you should add topical to regimen is basically when the oral plateaus and you're not seeing the results that you want. So will happier work if you're on testosterone replacement therapy? Yes, it's gonna work. It's just the fact that you are on testosterone replacement therapy, that by itself is gonna cause more hair loss. But if you medically need to be on TRT, testosterone replacement therapy, then you need to be on it. I mean, that's a mute point. My entire point previously was that if you don't need to be on testosterone therapy, sometimes patients try to supplement testosterone. That is going to hurt your hair loss, and you don't necessarily medically need it. So that part is bad. But if you need to be on TRT, then you need to be on TRT. You could still use Happy Head, and it's still going to work. Great questions. We get the TRT question all the time. That's a very, very common thing that people ask, and I completely understand it. Um, if you have thin hair naturally, but not too much hair loss, will happy and thicken the hair? Yes, definitely possible. It could. You have to use it for about 4 to 6 months. Usually, what happy does that basically it strengthens that hair and thickens it up. At least that what we see with under microscope and magnifiers, and that's actually how finasteride works as well. It reverses the miniaturization. So, although you naturally have thin hair over time, that hair must have gotten thinner. So, basically, a happy head could reverse some of that. Good question. Thank you so much. Do you recommend finasteride for women at all? It depends. We don't usually give finasteride to females below age 50 because of fear of getting pregnant, and you should not be pregnant and being exposed to finasteride simultaneously because finasteride is a category X. Now, if you're a female above age 50, there are studies of patients taking oral finasteride, female patients taking oral finasteride, and they do really well. So if you're above 50, yes, I do recommend it, and we do prescribe it. If you're, let's say you're a female, 52 with hair loss, then your customized formula is going to be finasteride 0.25% with minoxidil 6% of retinoic acid and some hydrocortisone. Now, if you're a guy with hair loss, then your formula is going to be slightly different. It's going to be finasteride 0.25 with minoxidil 8% and retinoic acid. If your wife is pregnant, is it okay to do just minoxidil? That's a very good question, and this is where like a lot of doctors differ. I'll just tell you personally, I'm very conservative, so although it is okay for you to use the minoxidil, sometimes I even tell the husbands not to use it. But again, that's very questionable because a lot of doctors say no, it's fine for the husband to use minoxidil only when the wife is pregnant. So every doctor is different. Everyone is going to have a different answer to that one. Um, Okay, I think we already answered. If you have fine hair in the crown, will Happy Head help to grow those fine hair thicker? Yes, that's the whole point of Happy Head. It should make it thicker. Again, it also depends on how fine it is, how much balding you have. So everyone's different. If there's any question, you could certainly feel free to send your photos to help@happyhead.com and they'll forward it over to me and I will evaluate it. But yes, if you have fine hair, Happy Head should thicken it up. Also, some patients kind of have lighter hair or gray hair. So although we say happy to thicken it up, you won't necessarily see it unless you basically go a little bit darker. So that's, please be aware of that. Is it true that finasteride is for hairline only? No, that is definitely not true. I mean, we have patients that are thinning all over the scalp and they go on finasteride and it really thickens everywhere. So that is definitely not true. Finasteride is used globally for hair loss, specifically on the scalp. It could help the front, the widow's peak, the hair behind the widow's peak, the frontal scalp, as well as basically the crown area. Does the efficacy of oral finasteride drop over time? If so, does the same apply to topical? Yes. The efficacy of oral finasteride does drop over time. Basically, you're going to hit that plateau stage. The same thing, of course, applies with topical. The only difference with topical is that you have two other ingredients in there to bolster the effect. So that's one thing. And number two, I have a lot of patients who have been on to oral finasteride for 10, 15. I saw a 49-year-old patient last week who's been on oral finasteride for 25 years. I mean, he started when he was in his early 20s. That's a long time. And, he has started to plateau. So in those instances, I figured out that adding topical finasteride to regimen really bolsters results and patients see much better results. Now, if the combination of topical oral finasteride doesn't work, then there's oral dutasteride that we could switch the patient over to. There's topical dutasteride that you could do, and there's also oral minoxidil that you could add. So remember, everyone's different, and if you have been on oral finasteride, definitely basically some of the consultations for the topical finasteride. And if that doesn't work out for you, please reach out back to us. There are other solutions. We would change out your oral or add another oral to it. Do you use Happy Hair for your hair? Great question. I used to use it actually, and then my wife got pregnant with our second kid, and I stopped using it. Thank God, the hair hasn't really fallen that much. I do take a multivitamin every day. I do use the ketoconazole shampoo. Also, I just recently started to use our Happy Hair shampoo, and honestly, it feels great. Even my son uses it. I just took a video of my son where I asked my son, "Do you like the Happy Hair shampoo?" He's like, "Yeah, Dad, I love the Happy Hair shampoo." I'm gonna post that video up one of these days. Um, but yes, so I used to use the Happy Hit formula myself years ago before we got pregnant. So I'm a big fan of it, and I've been using it as well. How long can you stop using the product without negatively affecting results? It's typically 4 to 6 months. I was losing it quite a bit, basically in the widow's peak area, but thank God, it hasn't really gone that bad ever since I stopped it. But it's typically 4 to 6 months. So let's say if you stopped, and this also goes with the oral. If you stop the product after 6 months, basically your hair is gonna go back where you would have been if you never used the product. And also, please remember that our topical also has minoxidil in it, and minoxidil is a dilator, so it's going to increase blood flow to the scalp. And the other day, I had a patient ask, like, "Doc, I've been on the Happy Head. Can I go on oral finasteride and oral minoxidil?" The answer is yes. I mean, there's nothing that's going to stop you. I probably wouldn't do everything all together. I would probably start with Happy Head first, use it for 2 3 months, and then you could add the oral finasteride to it and use that for 6 months. And if you see still not getting the results you want, you could add the oral minoxidil. And we do have all of that available at Happy as well, the oral finasteride and oral minoxidil. Can I take a break from treatment a week or less? Yeah, there's no problem. You can take a break for that shorter period of time. That is no problem at all. What you don't want to do is take a break for 4 months. Then, unfortunately, then it's negatively going to impact the results that you got. Somebody else asked, is micro needling 1 millimeter length okay with topical directly after? So I love micro needling. I think the 1 millimeter depth is honestly a little bit too deep, and it hurts. Usually I recommend a 0.25, 0.25 depth, and you could use it after you apply the product. Now, I have a lot of patients that do the 0.25 depth every day, and then once a week they do the 1 millimeter depth or 1.5 millimeter depth, and that's fine. I have no issues with that. But if you want to use it, but we've realized that patients that use it more consistently every day with a derma roller see better results. So lower the depth to 0.25 and do it consistently every day. Best way to find the best formula to start with. So your doctor is actually going to decide that for you. It really depends upon your allergies and things like that. So let's say if you use minoxidil and you got irritated, then we're going to basically lower the minoxidil concentration. If you had used oral finasteride in the past and you had side effects, we're probably going to start with the lower concentration of finasteride. But if let's say if you never used any finasteride or you had no issue with minoxidil, then we will start with our standard formula, which is the highest dose of finasteride, which is 0.25, highest dose of minoxidil, the 8%, retinoic acid, and hydrocortisone. So you're going to start with 4-in-1. And then we'll see how you do. And then from there, basically, we're going to adjust it as we need to. So that's what I would do. Over 80 to 85% of our patients are on the standard formula. And then from there, basically, we decide basically what they need. So I would just say, just fill out the information online and let your doctor customize the formula based upon the photos you send in and your past medical history. Thank you so much for that question. Somebody else asked, what is the benefit of cortisone in the formula? So the minoxidil is a little bit irritating. The product has a little bit of alcohol in it, just because otherwise the minoxidil and finasteride will not basically penetrate in it, it will not dissolve in it. So we need some hydrocortisone to reduce some of that irritation. So it's not a very strong hydrocortisone, it's a tiny bit. If you don't like it, you can certainly let us know and we'll customize it for you and we'll take it out. Thanks so much for that question. I just want to go back previous weeks. Basically, people asked, what is the difference between finasteride and dutasteride? Well, dutasteride inhibits two enzymes, 5-alpha reductase 1 and 5-alpha reductase 2, whereas the finasteride only inhibits one of them. So in theory, dutasteride may work better than finasteride. So, and if you like to basically just switch over to the dutasteride, please let us know, and we could definitely do that for you guys. Please email us at help@happy.com. What if you don't want a subscription? That's fine. Just purchase one and email us right away. Say, please cancel my subscription. Unfortunately, right now we do not have like a one-time purchase button. So just purchase one and have us put it on hold or cancel it for you, and we will be more than happy to do that for you. No problem. Also, let's go back to the derma roller question. Microneedling they come in different depths. 0.2 all the way up to, like, I think 2.5-3 millimeter depth. You don't need the ones that are really, really deep. The key is to do it consistently every day. So we recommend the 0.25 millimeter depth, apply the topical on top, and gently roll basically the derma roller on top of it. Again, 0.25. Also, Happy does have derma rolls as well, so if you need them, basically just let us know. Also, shampooing is important as well. We have come out with the Happy shampoo, which is a combination of, honestly, one of the best ingredients, DHT blockers out there. We basically what did was that we analyzed a lot of clinical studies, and also we analyzed a lot of the products out there and took the best from all the clinical studies and all the products and put them together. And so it's a really good shampoo and conditioner. We are also coming out with our own multivitamins. Hopefully in a month it's going to be released. It is probably one of the best multivitamins out there that has a combination of anti-DHT, basic DHT blockers, along with biotin and collagen and keratin. So that should be released soon. Let's see. When is the best time to apply the topical drops? Honestly, whenever you want, you could do it morning and night. It doesn't really make a difference. It doesn't have to be exactly 12 hours apart. Just morning and night, whenever you get a chance to do it, that would be great. When you use the finasteride minoxidil, did you experience any side effects? So I did not have any side effects. I did take oral finasteride years ago. I mean, this is probably like 7-8 years ago, and I didn't have any side effects from the oral finasteride either. You got to realize some people have side effects and some people don't. Results varies and side effects varies. So I had no issue. My older brother took oral finasteride for many years. In fact, my first cousin is on Happy Head. Actually, both of my first cousins are on Happy Head. So look, majority of people actually do not have side effects. We have thousands and thousands and thousands of patients on Happy Head across the country. And I'm the one who basically kind of screens and also goes through all the side effect profiles. But a lot of patients do not have it. So, but again, my recommendation is that do not start by applying the product twice a day every day. Gradually basically ease into it, and you're going to minimize any side effects as well. The new shampoo has ketoconazole 2%. No, the shampoo does not have a 2% ketoconazole. The 2% ketoconazole is prescription, and you could You could purchase that. If you want to purchase that, you could actually email us at help@happyhead, and we could basically try to get that for you. Currently, it's currently not on the website yet, but we do have it. But the shampoo, Evan, you might give me one of the shampoos. So the shampoo is non-prescription, but it has a lot of anti-DHT properties. Thank you so much. Really appreciate it. So this is the Happy shampoo. Oh, and this is a conditioner actually. My wife really loves the conditioner. So here's the shampoo, and what's key about this is that it's a biotin collagen shampoo where we have added keratin, saw palmetto, and argan oil to it. It has a little bit citrusy smell to it. It goes on really, and it feels really fresh. So, but we have it, but it's not available to order yet. But we also have samples as well. So I think we're probably gonna send out the samples basically soon. Here are samples. It's coming out. We're just kind of trying to update our website. Before we ship it out. But if you want it earlier, just send an email to help a happy head. If you have had hair transplant, will happy head help to maintain the transplant hair? Yes, absolutely. So we do a lot of transplants in our office, and also a lot of PRPs and stem cells, and we do have patients use happy head afterwards. With the transplants, please wait 6 to 8 weeks before you use the happy head product. Do you wash out the shampoo every time we apply Happy Head? Yes, I do wash it out. I'm trying to understand. So, so the way when I used to do Happy Head, I would do it in the morning and night. I would take showers at night, and I would basically put the shampoo on, and then wash out the shampoo. Oh, let me go back. I would shampoo first at night, and then afterwards come out and apply Happy Head on. So the Happy Head product would stay in my scalp all night. And in the morning, I would apply Happy Head again. I would basically take showers at night. I used to take 2 showers a day, but I have eczema, so my dermatologist said I should not take showers twice a day. So taking a shower only once a day these days. So if I haven't seen results in the first 4 months, what can I do? So first, great question. First of all, please send in your photos, because let's compare the before and after photos, because sometimes what happens um, is that you see yourself every day, so you can't notice the change. But sometimes we look at photos and it's like, wow, there's so much difference. I swear, I have patients that have been using Happy Head, and they grew so much hair and they did not notice. And when I compared the photos, they thought it was a different person. So, and it's called the pregnancy paradox. And when your wife is pregnant, you don't see the day-to-day changes unless you look at the photos. So it's the same thing. So please send in the photos. That's step one. Number two, if we see you're really not seeing improvement, we might switch out the topical finasteride to topical finasteride, and then we'll try that. And after a few months, if that doesn't work, I'll probably add oral medication, like oral finasteride, oral dutasteride, to your current regimen. Remember, topical and oral work better when you do it simultaneously together. If a patient isn't worried about side effects, do you offer both oral finasteride and topical solution? Yes, we offer oral finasteride, and I think ours is the cheapest based in the market. Please um, send an email to help at Happy, and they'll basically order for you. And what happens, and then you could take oral finasteride for 3, 4, 5, 6 months, and if you feel you're not seeing the result, then you could add the topical finasteride to the regimen. Is it better the new shampoo versus the ketoconazole 2%? Honestly, they're different. And basically, what I typically tell my patients is that alternate, so your body just doesn't get used to one shampoo. So you could use the ketoconazole 2% one day and our other shampoo the next day. They're just complete different. I mean, our regular shampoo has argan oil, keratin, collagen, biotin in it, and saw palmetto, whereas ketoconazole shampoo is only ketoconazole. So they're really two different products. So the more you alternate, you're using different products, and you're probably going to see better results. Yes, or maybe switch on both together. Switch them both together. Um, After applying Happy Head, how long do you wait to shower this? So when I basically so in the mornings I just apply Happy Head and I do not wash it out. You could wash it out if you're experiencing side effects of irritation. So if you're irritated, then you could basically just wash it out so you don't get the irritation that much. But at night, typically try to shampoo first and then apply Happy Head on afterwards. What does the shampoo do? Is it specific for specific conditions. So the 2% ketoconazole shampoo, which is a prescription grade shampoo, is an antifungal shampoo, has been shown in clinical studies to increase the caliber of the hair, thicken it up. The happiest shampoo is just an anti-DHT shampoo. It's a biotin collagen shampoo, which will help basically with hair growth, give your hair a shinier look. It also has supplemented, which is a DHT blocker, and argan oil and keratin. So they just work differently, basically to give your hair a much more shiny, healthier look, and also basically to induce more hair growth. I love my morning coffee. Could this cause hair problems? No, not at all. Coffee does not cause hair problems. Caffeine does not cause hair issues. There's no problem with that. No. So drink your coffee and enjoy. Okay, guys. Well, thank you so much for all those questions. It was great, and thank you for coming on to another Happy Head Happy Head session. Here, I'm going to. Okay, so here we go. So, where are all the products? Good question. So, again, currently, our website is being updated. So, you're not going to see any of the products on our website, but you could email help at happyhead.com, and they could basically, and they could help you with that. Um, After applying a happy head, how long do you have to wait to shower? I would say about 1 hour. So you could basically, if you wash it after an hour, the results are practically the same as leaving it out all day. Oh, thank you. Thank you so much. Well, guys, thank you so much for joining to another happy head session. We're gonna come back next week again at 10:30. I know, sorry, we had to change the time for some personal reasons. So we're gonna see you guys again next week at 10:30, and we're gonna have another session. If you have any other questions, feel free to email us at help@happy.com. Please remember this is a customizable product, and also please remember that you could get a discount on your product if you just refer a friend, and that is happy.com/refer. And I think you get $50 off. So and Evelyn's gonna put the link there. And thank you so much for to Evelyn, who basically coordinates basically all of our efforts on our AMA days, and also thank you so much to Eric, who is somewhere listening to my podcast right now. Who also helps organize everything and sends out all the email. Guys, again, if you have any questions and basically want to get evaluated as well, please take a photo of your scalp and send it to Help and Happy Head, and they'll be more than happy to run the photo by me, and I'll let you guys know if you're a candidate or not. And again, these are our happiest shampoos and conditioners, which are will be available soon on our website. Thank you so much, everyone. Have a beautiful day. Bye.